Thanks, Stephanie, and thank you guys for hanging in there for the last session. My name's Amy. I'm a postdoc working with Stephanie, and I'm going to be presenting some preliminary results from a study that I'm fortunate enough to work on, looking at psychophysiological reactivity to parent-child conflict as a predictor of emotional and behavioral dysregulation in everyday life, and also focusing on the influence of parental response to emotion. Emotional reactivity is a transdiagnostic risk factor for a wide range of psychopathology, including severe personality pathology like borderline personality disorder. ER represents a more circumscribed aspect of the broader temperament dimension of emotionality and can be conceptualized as a multifaceted construct. So kids who have higher ER may experience emotions more quickly and with greater intensity. They may also experience those emotions for a longer duration of time and have a slower return to baseline, and may also be more variable in their experience of emotion with frequent and extreme fluctuations in those emotions over time. Importantly, this neurobiological vulnerability is thought to underlie both emotion dysregulation and behavioral dysregulation, and these are some of the most common symptoms that our patients may present with, and often ones that are really difficult to treat. So in trying to better understand ER as a risk mechanism, researchers have looked to peripheral physiology indices. And we can think of this as kind of capturing the dynamic endophenotype. So a measurable link in the chain leading to personality pathology that is vulnerable to changes during key developmental windows and also is both affected and affects the environment with which it exists. Respiratory sinus arrhythmia, or RSA, has been one physiological index that has received a lot of attention. This is one of our most direct measures of the parasympathetic nervous system, which, if you can think back to biology in high school, is our rest and digest or kind of regulation system. We can think of it as our body's capacity to regulate its own arousal. And when we're measuring RSA, we're really measuring variability in the heartbeat. So we think of our heartbeat as pretty static, and it is. And there's also slight variation in the distance between each of our heartbeats that's actually a function of our respiration. So when we're inhaling, our heartbeats are actually closer together, and when we're exhaling, they're actually further apart. And with greater parasympathetic influence, the time with which we're exhaling actually increases, which serves to elongate the time between our heartbeats and kind of regulate our breathing and our overall arousal. So greater RSA or greater variability in between our heartbeats is actually indicative of greater parasympathetic function. And decreased RSA at baseline, as well as excessive withdrawal of RSA in response to stress, has been associated with behavioral and emotional dysregulation, as well as a wide range of psychopathology. When we think about studying RSA, one of the key developmental windows may be the transitions to adolescence. So adolescence is characterized by the emergence of personality pathology symptoms, as well as the divergence of persisting and desisting trajectories of these symptoms over time. This is a developmental period that's marked by normative fluctuations in ER that is likely related to the drastic changes that our neurobiology is undergoing during this time. And while most youth actually dissipate with their levels of ER over time, those youth that have elevated or increasing levels of ER across adolescence are actually at most risk for psychopathology later in life. In addition, adolescence is characterized by increases in interpersonal conflict, specifically increases in parent-child conflict. If any of you have worked with adolescents or have adolescents of your own, I'm sure this is no surprise. And we can think about parental response to emotion within these contexts as a way to either mitigate or exacerbate risk. So in thinking about the influence of parental response to emotion, research suggests that even though adolescents are becoming more autonomous and may their relationship with their parent is changing, that the parent may actually still be an important scaffold and really an emotional coach for how to manage their emotion during this transition. And we know that validation of emotion contributes to positive social emotional development, while invalidation, such as ignoring or neglecting emotion, or even punishing certain emotional expressions in certain contexts, is linked to emotional behavioral dysregulation as well as psychopathology. However, the influence of parental response to emotion has really been studied most intensely in childhood, despite the fact that it likely is still playing a really significant part, especially for these at-risk adolescents, in terms of contributing to risk or mitigating risk. So in the current study, we assessed emotional reactivity in the lab and really wanted to expand on previous work by looking at multiple different facets. So we looked at reactivity to conflict as well as recovery from conflict and overall instability over time as predictors of these really hallmark symptoms as they're manifesting in daily life. So we looked at both dysregulated behavior and variability in negative affect. And also, in more exploratory analyses, wanted to assess the extent to which parental response to emotion, so either validation or punishment or neglect of emotion, was influencing the manifestation of these behaviors as well as emotional reactivity as measured in the lab. So we examined these aims in Stephanie's Moody study with 129 youth and their primary caregivers, the majority of which were maternal caregivers. These youth are 11 to 13 years old, so transitioning into adolescence with a mean age of 12. Almost half of them are female, a little over half are African American. And importantly, this is a clinical sample, so all of these youth were in mental health treatment and also demonstrated moderate to high levels of ER as assessed by the PAI. Youth come in for 3 assessments. I'm going to be focusing on the baseline assessment here because this is the majority of the data that we have right now. And all of the youth and their parents participate in a psychophysiological protocol where we measured both RSA and heart rate, as well as some other indices that I'm not going to be focusing on today. They have a dyadic baseline where both the parent and the child are in the room together, sitting there silently, and also one where they're reading kind of benign material aloud. We then ask them to think about something that is really contentious for them right now and then to talk about it for 8 minutes. So they have some time to think about what that is, to think about kind of their stance on that and what they would like to express to their child or their parent, and then we leave the room and ask them to hash it out for 8 minutes. After that time, they're given some time to reflect on that. We also ask them to plan a pleasant activity, that's something they enjoy doing together. And then we have a dyadic recovery where they're, again, still together and not participating in any specific task. We asked the youth and their parents, so I'm going to be focusing on the youth today, to also complete an EMA protocol. So they're given cell phones over a long weekend, and we give them 10 time-based prompts where they're asked a number of different questions about how they're feeling right then, the types of behaviors they've engaged in, and then lastly ask them to fill out a number of questionnaires. So our primary study variables, so first our psychophysiological indices of ER. So here I've plotted 2 actual participants' data. So you can see at baseline, they're not very different on their level of RSA. So this is a Z-score, so they're standardized. The lighter blue line shows a participant who does have RSA withdrawal, but it's not as excessive as the darker blue line. And then you can see for recovery, the lighter blue line, the participant kind of returns to baseline, whereas the other participant really stays at a level where there's less RSA variability, and we interpret that as less parasympathetic or regulatory function. So we looked at reactivity to conflict, where we subtracted baseline levels from conflict, Also recovery from conflict, where we subtracted the recovery levels from the conflict. And then lastly, at variability, where we actually looked at RSA across the entire protocol and took the difference between each of these time points, squared it, summed it, and then took a mean. So really, what is the overall level of variability for this person across the entire protocol? When looking at dysregulation in everyday life, we asked the youth at the end of every day, when you were feeling your worst, did you let your feelings out by crying or screaming, yelling at someone, or hitting, slamming, or punching someone or something? And they just responded yes or no. About 40% of the youth reported crying or screaming and or yelling at someone, and about 20% of the youth reported actually being physically aggressive in some way. We also asked youth about self-injury during these times. It was a really low base rate, and so didn't load really well with this factor. We also asked about emotion. So in the past 15 minutes, how much have you felt all of these negative emotions? We combined an overall negative affect score, and then similarly to what we did with the physiological data, we looked at the difference between each time point and took an overall mean level of variability. And then lastly, for parental response to emotion, we use the emotion socialization measure, specifically the youth report. So this is the youth's perception of how their parent is responding to emotion, which I think is really important and we'll come back to later. So we ask the youth when they're feeling 4 different emotions, so sad, mad, scared, or ashamed, how likely is it for your parent to neglect your emotions, so not notice, not be around, actually punish you for feeling this emotion, call you a crybaby, those type of things, and conversely validate these emotions. So try to understand what's going on, ask you questions about it, try to comfort you. So for AIM 1, our reactivity to conflict included RSA reactivity, controlling for baseline levels of heart rate and RSA, recovery from conflict, and overall instability or variability in RSA over time as predictors of dysregulated behavior, which included the 3 items that I mentioned before, and variability in negative affect. So first, looking at reactivity to conflict, we found a positive association with dysregulated behavior in everyday life. So those youth that were more reactive to conflict, meaning they had greater RSA withdrawal, were actually more likely to engage in dysregulated behaviors in everyday life. And there was a non-significant association with variability in negative affect. When looking at recovery from conflict, this was actually not associated with either behavior or emotion dysregulation in everyday life. And then finally, looking at overall instability or variability in RSA across the entire protocol. While it was unrelated to dysregulated behavior, it was significantly associated with variability in negative affect in everyday life. And then our second aim, we wanted to start looking at how parental response to emotion may impact these relationships. So first, looking at our significant association between reactivity to conflict and dysregulated behavior in everyday life. Looking at both punishment and neglect, validation was included in these models as well, but was non-significant. Punishment of emotion was significantly related to dysregulated behavior and marginally related to the youth's reactivity to conflict. With regard to overall instability or variability in emotion, neglect of emotion, so not noticing that these emotions were happening, ignoring them, was associated with variability in negative affect in everyday life, and was also marginally associated with overall instability in RSA during the protocol. So to summarize, RSA reactivity, as indexed by greater parasympathetic withdrawal to parent-child conflict, predicted dysregulated behavior in everyday life. So this reflects decreased RSA, so decreased variability, decreased parasympathetic influence, decreased regulation of your overall system. And I think we can think about this as in terms of kind of removing the brake of a train that's going pretty fast. So in these high conflict, high stress situations, our regulation system, or these kids, those kids whose regulation system really went offline were those kids who were most at risk for engaging in dysregulated behaviors in everyday life. we can think about it as the conflict discussion kind of overwhelming the system. And we have measures of the severity of the overall conflict between the dyads to look at whether or not that may account for some of this observed association. Variability in RSA, predicted variability in negative affect in everyday life. So in this case, the physiological index of variability mirrored the subjective report, which I think is really interesting, and certainly we want to follow up on that. And this physiological profile suggests that paced breathing may be one intervention that is particularly helpful. So paced breathing actually functions to increase the amount of time that you are exhaling and slow down your breathing, which induces your parasympathetic system, induces greater variability in your heart rate. And for these kids whose system is going offline, practicing these skills in everyday life and even in these conflict situations may be really helpful. Parental response to emotion was also associated with emotional and behavioral dysregulation in daily life. And trend level significance for the psychophysiological indices of ER. Specifically, neglect and punishment of emotion was associated with greater behavioral and emotional dysregulation in everyday life, and marginally so, greater reactivity and variability in youth. While mediation pathways were not significant, we are also interested in looking at moderation. So for those kids who are most emotionally reactive, is parental response to emotion actually more important for these kids? And I think that what's exciting about that is I think it can go both ways, where these things may be these kids are particularly sensitive to their parental response, and while neglect and punishment may be particularly detrimental, more positive things like validation or shifting those responses may also be really helpful for these youth. I also just want to go back to the fact that parental response to emotion was assessed by child report, which I think is really important. So this is their perception of their parents' response to emotion. It's certainly not the absolute truth, and it's really important in our data. So however the child is experiencing their parent is really important to how to their emotional reactivity, and also to how emotion and behavioral dysregulation is manifesting in everyday life. I think it's possible that, these parents may or may not be neglecting or punishing emotions, and that may just be the child's perception. And it's also possible that the parents may be doing those things with the best of intentions. Maybe they're noticing these emotions and don't actually know how to respond. So it's perceived as by the child as neglect, and really the parent just doesn't know what to do in these situations when they're noticing their child being really upset. So I think the good news about that is there's certainly modifiable targets for intervention. How can we help the parents to better support their children, a goal that I'm sure is shared by the parent, and how can we help them to do that in a more effective way? Maybe these strategies worked with other siblings in the family and just aren't working that well with this child, and how can we help shift that so that we can achieve better outcomes for the child? So in terms of future directions, I think looking at transactional associations, so not just how parents are affecting the child, but how child is affecting a parent and how that contributes to the development of these symptoms over time. Along with that, using our longitudinal assessments to look at these transactions over time, and also to look at how these symptoms of behavioral and emotional dysregulation are related to actual symptoms of pathology in the future. And then lastly, using a multimodal assessment of all of our constructs of interest. So for ER, we have physiological data. We also have subjective report and observational coding of both the child and the parent in the moment, as well as their interaction. And I think incorporating all of those pieces of data to really give us a more comprehensive picture of what's going on, and so we can better understand risk, is really important. So thank you guys for listening. Thanks to all the Moody participants and their families, Stephanie for being an awesome mentor, and the many, many people and funding sources that allowed this to be possible. Oh, you want me to answer a question now? Sure. Yeah. If anybody has any questions they just can't hold on to. Feel free.
I have a technical board question.
No, sure.
Which is just, I don't know this kind of research, but within the conflict paradigm, how do you identify the conflict in the 8 minutes, and how do you identify the resolution of the conflict in the 8 minutes?
It's a really good question. So these data here looked at the overall epic. We actually, which is an average across the entire time, and could include, so some families fight for the entire 8 minutes and, you know, at the end are ready to storm out and leave. Some families do work to resolve it, and I think two things. One, we have it broken down minute by minute and also second by second, where we can kind of separate that and get a better idea of what's happening. Two, I think using the behavioral coding to better understand what's happening temporally will get at some of those more nuanced questions.
How did you do it here for this presentation?
So this was just the full 8 minutes.
Okay.
So for everybody, regardless of, you know, the severity of the conflict, regardless of if they were, you know, scratching their eyes out the entire time, it was just an average of the whole time.
You had two variables. The one was conflict, and the other one was
Recovery.
How as they recover.
So right. So it doesn't necessarily mean they resolve the conflict. So we ask them to talk about this conflict for 8 minutes, and then the protocol continues on, and we're interested in those kids that kind of stay at this heightened level of emotional reactivity versus those that return to what their baseline levels were. Does that make more sense?
Yes.
Sorry.
I have a question, Amy.
Sure.
So you found this sort of nice, distinct association between neglect and punishment, and then neglect was related to
Variability.
and affect, and then punishment related to dysregulated behavior. Do you have any ideas about what that might tell us, or what might be going on?
That's a good question. So I think it's really interesting, and I guess in thinking about variability and affect, if you're thinking about the youth perceiving that their parent is not noticing how they're feeling, I could imagine that leading to greater fluctuations in emotion, perhaps in an attempt, not even necessarily consciously, to get someone to pay attention to their emotions. So yeah, like that it's they amp things up or escalate even subconsciously because their emotion is not being validated in the moment, and I could imagine that contributing to more frequent and kind of more extreme bursts of negative affect. And then with the behavioral dysregulation piece, I think when I actually looked at the specific emotions, it seems to be punishment of anger, which I think is really interesting because I think a lot of times, especially for these kids who are really reactive and, you know, things come out in ways that we may not like, that when anger might often precede that. And so parents who are anticipating this is going to lead to some type of outburst, which makes complete sense, it probably often does, are actually punishing the anger. And I think if we could intervene there and help them to validate and kind of shift the trajectory away from kind of the dysregulated behavior, it may be more effective for both the parent and the child.
The population of children, was it borderline children?
So it's kids that have high levels of emotional reactivity and are in treatment for a variety of different disorders. So some of them are meeting criteria for BPD at baseline, and some are not, and we expect that they will go on to develop the disorder. But it's a kind of a wide transdiagnostic sample that's really high in emotional reactivity.
I'm curious because you're dealing with borderline kids, they're very likely to misperceive the
Absolutely.
argument, bias to the negative,
Absolutely.
self-referential, get angry, feel shame, and then anger, and then they can say just about anything.
Absolutely.
So they're going to ratchet up the level. It's kind of like almost unfair. You have it in a fishbowl.
Yeah. No, I think that's a really good point, and I think we could actually look at BPD symptom level and symptom severity as a moderator of these relationships. So for those kids who are higher in BPD symptoms is that what really is driving the relationships that we're seeing here? Is it look different for those kids? I think it's a good
Because if the parent is getting a super high reaction from a very minimal kind of a
Absolutely.
statement, then the whole thing is askew.
Of
and
course.
How are you going to measure that?
Right.
I mean, you're here for the parents. How do they understand when the kid has a very high reaction to kind of benign statement?
Right. I mean, I think that's a really good point, and you know, I think something that I focus a lot on when I'm working with these type of families and trying to better understand that transactional process, help them better understand it, so that we can try to intervene before things get up here, in a way that feels good to both the child and the parent.